For the private sector, the basic question is who pays for it? And I think UHC just simply gets down to a matter of where's the finance coming from?
I think the key focus and underlying issue in universal healthcare coverage is coverage. So if you don't understand your costs, how are you going to price it? How are you going to claim it? And we have a few notable examples of such in different geographies where not only have we enabled the collection, the tracking, and the analyzing of data, but also enabled more powerful analytics and insights on such data blocks.
We all want every single person to be covered, but how can we do it?
So it's really a question of what's the mechanism of payment? Who pays for it? And I think the private sector is a key player in providing the facilities, you know, whether it's service providers, whether it's pharmaceuticals, whether it's equipment providers, and so on.
Being insured is one thing, but we need also to make sure that, as per the concept of universal coverage, to ensure that those who are even insured should not get, financial hardship.
Can you imagine a country in Africa where more than half of health provision is delivered through private sector, and where we want that every citizen has equitable access to quality healthcare without financial hardship.
We can only build a strong healthcare system with strong primary healthcare.
Well, the biggest challenge is really reaching everyone with all these beautiful policies and strategies.
In the context of South Africa, very few people have got access to quality healthcare through private medical aid schemes or through private insurance.
The government is the one who sponsors all the healthcare, public healthcare service with the national budget.
You cannot treat 16% of the population and leave 84% aside. It's more expensive to do that. And the more people you treat, the better it is for the economy.
It should be a payer-provider relationship.
So it only happens when the private sector is strong enough to support the initiative that is launched by a government. And for that to happen, it needs time. We cannot just come and sell hope, but we know that this is our target. We know this is the goal that we want to achieve.
So we need to go beyond conventional means in accessing those people.
We have other alternatives, such as build a strong public insurance.
We need this collaboration between public and private, working together hand in hand to achieve universal health coverage.